Hello, my name is Johnny Chisano. I'm a second year pharmacy student at UNC Eshelman School of Pharmacy, and today I'm bringing you the news you can use for March 2024. Let's get right into it. Here is an overview of the topics I will cover today. First, we will talk about Dexcom Stelo, the first over-the-counter continuous glucose monitor coming soon. Next is Xhance, a new drug delivery system for fluticasone, a drug commonly used to treat allergies. Finally, we will conclude with talking about the incoming cap on out-of-pocket costs for COPD and asthma inhalers set by various pharmaceutical companies and what that means for patients. First, let's cover Stelo. The Dexcom Stelo was announced by Dexcom on March 5th as the first integrated continuous glucose monitor to be available in the US for purchase without a prescription. It will be available for purchase starting sometime in summer 2024, with an exact date to still be announced by the company. The sensor for the CGM lasts 15 days, which is longer than any current CGM on the market, and has the added benefits of tracking glucose every 15 minutes and being able to pair the sensor with an app that is downloaded on smartphones. The app has also not been announced yet by the company, but will run similar to how Dexcom G7 utilizes the G7 app, and the Dexcom G6 utilizing the G6 app. Data sharing will be enabled by using the Dexcom Clarity software so patients can share their glucose data with their providers to help visualize trends in their daily glucose values. Stelo is targeted towards two main patient populations. Population 1 is anyone that is over 18 years old with type 2 diabetes not on insulin, and population 2 includes patients that want to include how their overall diet impacts their daily glucose values. There are currently 25 million people in the US living with type 2 diabetes that are not on insulin treatment, so there is a huge opportunity for Stelo to make an impact in regular glucose monitoring in patients that either do not check it themselves or are frustrated with the everyday finger pricking required to get the values. While Stelo is not intended for patients on insulin, it is not an absolute contraindication. Insulin patients can still use Stelo, but they must understand the risk of hypoglycemia events occurring due to the CGM not having an alarm system for when low glucose occurs, and as a precaution, should have a traditional blood glucometer on hand to check their true blood glucose value. Additionally, patients on anti-diabetic medication should always consult a healthcare professional before making medication adjustments based on the displayed values of the CGM. As previously mentioned, Dexcom Stelo is created by Dexcom, which is the same company that also created the Dexcom G6 and G7 CGMs. Here is a side-by-side comparison of the Stelo to the previous models, with the G6 on the left and the G7 in the middle of the slide. The size of the G6 sensor is a bit smaller than that of a typical pink eraser, and the G7 is about the size of a quarter. The Dexcom Stelo is predicted to be about the same size as the G7 or a bit smaller, making it a convenient size and non-obstructive nor intrusive in a patient's daily life. Here is a chart that compares Stelo with other CGMs that are currently available. As noted in the upper outline box, the Stelo does triumph in the sensor lifespan category, beating out the Libre sensors by an extra day and the Dexcom sensors by a whole business week, which is great for patient adherence and cost. Speaking of cost, the price of Stelo has not been officially announced by Dexcom yet, so there is much room for speculation on how affordable this product will be. Stelo will most likely be cheaper than the cash prices of other CGMs to ensure access and affordability to the more expensive patient population they are targeting with the product, but it is still an unknown and a variable for its success that is left up to Dexcom to decide. Next, we will talk about Xhance. It is a new delivery system for the drug fluticasone propionate. It became the first therapy approved for chronic rhinosinusitis without nasal polyps in patients 18 years and older. The new delivery system is unique in that it utilizes an exhalation delivery system that relies on the ability of the patient to blow actuated doses of the medication right into their nostrils rather than spraying a dose directly into them with an actuator. Pictured on the left is an image of the Xhance device. The main components include the bottle containing the fluticasone medication, the flexible mouthpiece that the patient blows into, and the nose piece which is inserted into the patient's nostril and what the fluticasone from the bottle and air blown from the mouth flow into. Xhance is designed in a way that makes the patient blow into the device, which closes the soft palate located in the back of the mouth and is circled on the diagram on the right. Closing this soft palate will allow the medicine to go high and deep within the nasal cavity to target nasal polyps and treat allergic symptoms without dripping down the back of the mouth as some nasal sprays currently do and cause an unpleasant taste for patients. Here are the 4 simple steps for patients to administer a dose of Xhance to themselves, including the instructions on how to prime the device if it is new or has not been used in 7 days. An important patient education point is that they are blowing and exhaling air when using Xhance, as opposed to sniffing, which is commonly used with popular nasal sprays. Using Flonase as a comparative product, since it is also fluticasone, we see that Xhance can provide patients with a greater daily dose compared to Flonase, depending on how a patient takes it, which can allow for better treatment of allergic symptoms. Xhance also allows greater flexibility and freedom in dosing for a patient, depending on the severity of their allergies, which can be 1 to 2 sprays into each nostril twice daily, providing 186 to 372 micrograms daily, thanks to its 93 microgram per actuation dosing, something that Flonase lacks since it has a fixed dose of 2 sprays per nostril once daily at only 50 micrograms per actuation. When comparing other factors of Xhance to other available nasal sprays, some main points are that because of its unique delivery method, it can be more difficult for patients to use since they are used to nasal sprays. Xhance is also much more expensive than a bottle of Flonase or any other nasal spray, coming in at a cash price of $670 for a 30-day supply of it. Additionally, there are no current trials that compare Xhance to other nasal sprays on the market. The only trials involving Xhance were the reopened 1 and 2 trials, which compared it to placebo and showed significantly beneficial improvements in nasal congestion, facial pain or pressure sensation, and nasal discharge. I am unsure on how prevalent Xhance will be, but I would like to see some more data on it, specifically comparing it to other nasal sprays. Moving on to our last topic, the pharmaceutical companies Boehringer Ingelheim, AstraZeneca, and GSK all announced that they will instate a cap of $35 per month on the out-of-pocket cost for all the COPD and asthma inhalers that they produce and are within their portfolios. This move is as impactful and significant as the $35 cap that was put on insulin last year due to the volume of patients this helps. For reference, 14.2 million U.S. adults had physician-diagnosed COPD in 2021, and 24.9 million Americans are currently living with asthma. While this cap will help every single patient that needs an inhaler, it greatly reduces a significant cost barrier for the under and uninsured patient population, which will help lead to better adherence and outcomes due to more patients being able to afford their much-needed inhalers. The price reduction program will begin on June 1st, 2024 for Boehringer and AstraZeneca, and will begin no later than January 1st, 2025 for GSK. Here is a list of inhalers made by Boehringer Ingelheim that will be impacted by the price reduction, which contains the commonly known Spiriva line of inhalers. A quote from Jean-Michel Bors, the president and CEO of Boehringer, regarding this announcement was, "We want to do our part to help patients living with COPD or asthma who struggle to pay for their medications. This new program supports patients with predictable, affordable costs at the pharmacy counter." Next, here is a list of inhalers made by AstraZeneca that also will be impacted by the price reduction. Of note, Symbicor's price had already been reduced by a significant amount on January 1st, 2024. The CEO of AstraZeneca, Pascal Soriot, commented in regard to AstraZeneca's announcement, in quotes, "We remain dedicated to addressing the need for affordability of our medicines." Finally, here is a list of inhalers made by GSK that will be price reduced. Most will be familiar with the Ellipta and Discus line of inhalers. Maya Martinez Davis, the U.S. commercial president of GSK, commented on the announcement. In quotes, "This new commitment, combined with our existing offerings, will help even more patients living with asthma or COPD. Let's review what we covered in this video. Today, we went over a CGM that will be available over the counter for anyone to buy and observe their glucose trends, a new delivery system for an allergy medication, and a new initiative from pharmaceutical companies to make inhalers more affordable for vulnerable patient populations. Here are the references that I used to create this presentation. And that is the news you can use for the month of March in 2024. I'd like to thank Dr. Koval for helping me on this presentation, and I hope you all have a great rest of your day.